Hi, good afternoon, everyone. How are you all doing? Happy weekend to everyone. Okay, I want to discuss something with us today on the topic Bowel Elimination, which is the problem where they make us feel know the toilet well. I will try as much as to break everything down to our understanding. So, the reason why people know they go toilet well, the problem where they cause and wey be say some people still dey, wetin dey affect them. Why the reason why you see say some people just dey tell you say in toilet no dey waste time na im don feel am. Once e enter there, im don do wetin e wan do. While there are still some persons, they will wait even when they will still get to that, they will fit press moment they still enter toilet they no go fit defecate. So today we're going to talk about what those things. So it's me, your girl Usato Edu Babe, popularly known as the health educator. So I'm a content creator and a health educator. If you want to know more about health, I don't know it all, you don't know it all. But we are here to help each other. We are here to share our ideas. Some people can be going through one or two things, which you might have the solution, but because you feel if you say it out or when you say it, should it be the right word or are you really saying the right thing? But just say it out. Inside nonsense, there is sense. So today, that is what I want to share with you on what bowel elimination. So let's go. Let's talk about bowel elimination. So when we talk about this bowel elimination, what is bowel elimination? Bowel elimination is defined as the passage of stool through the intestinal tract and dispelling of what stool by what means of intestinal smooth muscles contraction. Intestinal stool what contraction. I will say it again because I jot everything that so I have to just read. Because like I said, today I want just take my time to talk about this particular topic. So when we talk about this bowel, it means what a bowel elimination is defined as a passage of stool, which means where you take the toilet through the intestinal tract and dispelling the stool by what? By the means of intestinal smooth muscle contraction. It is when you have smooth muscle contraction, that is when you can easily stool well. What you have, thanks for joining. Please, if you are joining, help me to share the video. Help me to share the live. So bowel elimination is what is defined as a passage of stool through the intestinal tract and dispelling the stool by what? The means of intestinal smooth muscle contraction. You can see that your muscle contraction helps you in stooling. So if you be the type where we say you dey feel, some people they once they enter toilet, they never press their self, be say they will use all the strength, they come out. So when you have this smooth muscle contraction, it helps you in what? Stooling. It helps you. When your muscle and your contraction, they okay, they free. It helps you in stooling. Okay. So we have the risk. We have the risk factor for what? Problems of what? Elimination. We have the risk factors. Okay, everything what they do for this life, it gets a advantage and it gets disadvantage. So everything has effects. You will not just expect those things to just be going so smoothly without having the effect or without you seeing the signs or even passing through the challenges for life. Now person will say gets challenges for life. So same way. So it has risk factor as well. There's a risk factor for what the problem of what elimination. What are these risk factor? One is what the condition that result in what neurologic what impairment, neurologic impairment, neurologic what impairment. So we have like someone that has trauma. We have the trauma to the brain or spinal cord. Someone that has problem with trauma that has to do with the brain and spinal cord. You see the risk factor. So we have what the CVA, we have the diabetic neuropathy, okay, which is under what the metabolic derangement, okay. So the metabolic or derangement, sorry, the metabolic or derangement. So you can see that we have risk factor under what this particular what Bowel what elimination. It has its own problem of elimination, problem of toileting, problem of defecating. You wan go shit for toilet, the problem wey dey cause am wey you no dey fit do, and what are these things that makes you not to able to, those things that has become the problem and you cannot defecate so easily. Yes. So we have the what altered mobility. We have that, which means severe arthritis. Someone that has severe arthritis, you know, if he press himself, when the muscles are not smooth, it cannot contract. It cannot. We all know arthritis. So someone that has severe what arthritis, they will have the what the congenitive what impairment, which means dementia. Someone that has dementia, what's it called? Problem is another thing. Someone that has dementia problem is another thing. Okay, so we have the what immunologic what impairment or infection. Immunologic what impairment or what infection, e.g., let's say AIDS. Let's say what AIDS, someone that has what AIDS. So you can see all this put together as a result of what the neurologic impairment, the severe arthritis, the diabetes, the dementia, and this AIDS infection put together. You'll be able to see that these are the problems that affect people on what Bowel eliminations. These are what the things that affect people from what Bowel what elimination. So when we talked about this Bowel elimination, there are still things that we need to know outside this Bowel elimination, which is the factors affecting defecation. Under what this Bowel elimination, we have factors that what affect the what defecation. Factors affecting our defecation. What are these factors that is affecting our defecation? One, we have age. Age. Two, we have the diet. Three, we have physical activity. Then four, we have fluid intake. Okay, then we also have what personal habits. Personal habits is one of the factors that affect our what our defecation. Like I said, we have the age, we have the diet, we have the fluid intake, we have the personal habit. Position during what defecation is also one of the things that what can affect your what defecation. We have pain, then we have pregnancy, we have surgery and what anesthesia, we have medication, and we have what diagnostic what test. So all these in this bracket together are one of the factors that what affects you what from defecating. Is one of the factors what affecting defecation. So you can see now that Bowel elimination has different categories, have different things that what easily affect us from defecating. Thank you for joining. God bless you, sir. Thank you so much. If you want to join me live, you can send request and I will join you. Help me to share. Thank you so much. We are talking about what Bowel elimination. What is Bowel elimination? Under the category of what defecation. Like e.g., let's break it down. You want toilet, wetin dey cause the problem? You see some people they no dey fit toilet, while some they easily toilet. So this is what I'm talking about today, which means another word is what Bowel elimination. Okay, that is what we're talking about, the passage of you stooling, and also when it helps you to what, the when your muscle is smooth for construction, it helps you to what, stool very easily. But when you have the when you are under this problem that has to do with someone that has infection, the neurologic infections, the neurologic impairment, the infection aspect that has to do with AIDS, the severe arthritis, those things are one of the things that what affect or are the problem of what defecation or what bowel elimination. So outside that, we now have what the factors that is affecting our defecation. You can say, what has age got to do with the defecation? Yes, age. Age is another thing. What are the age? Old person wey don hold very well now, that person don age, and at the end of the day e come get strong kakaraka shit to go shit, shey e no go affect am? E go affect am when no be say all im muscles are weakened and they are not smooth for him to what contract, so it will affect him. So we have age, we have diet, we have fluid intake, we have personal habits, we have position during what defecation, we have pains, we have what pregnancy, surgery, anesthesia, and we have medication. We also have what diagnostic what test. Those things are what factors affecting what our defecation. So another thing is what helps us promote elimination. Wetin dey help us dey be say if you really go toilet, now you don toilet, you no dey find am difficult to toilet at all. If they wan rate people wey dey go toilet wey no dey fit quick, you are not included. What are these things? One is stress-free environment. Stress-free environment. Stress-free environment. Let's use environment as an example. You dey come from somewhere now, you wan poo, the shit don hold you very well, and at the end of the day you come see one small bush wey you run enter, shey na when you dey check whether snake dey there or person dey come, you be worried. So the environment is not free. But when it is a stress-free environment, your defecation goes very easily. Okay, so ability to follow personal bowel habits, ability to know what you take, what you do. So that is the ability to what? To follow personal bowel habits. Privacy. You see the privacy, you dey inside toilet now, you lock and allow you wan dey inside. Anyhow you do. But there are some persons when they hear say person waka pass, they go hold am. Go say if you make boy just now, or the way go take that pop 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 pop, they go say na person dey toilet. So ability for you to know what your what bowel habits and what's your privacy. And also we have what high fiber what diet, high fiber what diet. We have normal fluid intake, like your fruits, the juice, and warm what liquid water. So do you know that warm liquid water that we take helps us to what detoxify our stomach? It helps a lot in terms of this boy, in terms of this defecation. It helps. So we also have what exercise, like walking, exercising yourself frequently every day. It's also what part of what the factors that helps you what in defecating. And also we have what ability to assume squatting position, ability to assume what squatting what position. Then we also have what properly what administer what laxative what pairs. So those things help you to do what helps you to defecate so easily. So you just enter toilet, you just go and go just come out freely the way you take want am, without stress, without complaint. So these are one of what the things that helps you what to defecate so what easily. And also we have factors that reducing or factors impairing what elimination. Factors impairing what elimination. What is this impairing elimination talks about? It talks about emotional anxiety. It talks about emotional what anxiety. Please excuse me. it talks about what? Emotional what? Anxiety. And two, we have what? Failure to heed defecation. And relaxed lack of time and what? Privacy. Relax what? Lack of time and privacy. Like I talk about the privacy. When people are there, they are seeing you, it is not longer privacy. So that alone helps you not to defecate very well. But when people are there, it is a problem. It reduces what? Your defecation. So we have what? Reduced fluid intake. We have what? Immobility and what? Inactivity. We have inability to squat because of immobility. Okay, muscle what? Skeletal deformity, pain during what? Defecation, which means you wan squat now, like now, thank God for the modern closets we have. Before, you have to squat, and if you are the type, like I said before, that have maybe the severe arthritis, so someone that has such pain and it could not squat, when you're finding it difficult to squat, is another problem for you not to what? Be able to defecate very well. So people having deformality, pain during defecation, okay. Then we also have what? Overuse of what? Cathetic what? Neurostic allergies. So those things alone can as well what? Cause or reduce you from what? Defecating very well. I just hope this particular topic gets to help someone today. Okay, so the last one for this particular one is promotion for normal elimination. When we talk about promotion for normal elimination, in medical terms, we have what we call proper scope. Proper scope. In that proper, by POOPER. So this POOPER has its words accordingly. P has what it stands for. The O has what it stands for. Another O has what it stands for. P has what it stands for. E has what it stands for. R has what it stands for. Same with what? That scope. So when we say proper scope, which means proper scope, the proper aspect means position, which means upright sitting. Upright sitting. Which one is this? One is what? S for normal elimination. We have the position upright what? Sitting. Then we have output. Output is what? Adequate hydration. Adequate hydration. Then we have offer fluids. We have privacy. We have the exercise, and we have what? Report results. If you see when I talk about that, privacy matters a lot. Privacy matters a lot. When you have privacy, it matters a lot. So privacy, exercise, report results. So we have this scope. What are the scope talking about? It has exercise, it has size, which means the amount you're pulling. So size, consistency, we have the acute blood, we have the odor, and we have the what? Peristalsis. So all these ones put together are what? The things that helps what? In the promotion of what? Normal elimination. So now I guess you'll be able to realize that defecation is not something that is why we'll tell you someone has diarrhea, they'll tell you you have to go through this person, or you are the type that you face challenging in defecating. Just with this, I hope you'll be able to know that there are things that you're doing that you're not supposed to be doing. Okay, know what you take, know your intake, know your gauge, know what you're not supposed to take. Do the right thing at the right time. Don't do things because you want to do those things. No, do it at the right time. Make sure you are always on fruits. It helps you a lot. Warm water, it helps also. So those things are the things that you need that will help you to what? Detoxify what? Your body for normal what? Or for good and proper what? Defecation. Without stress. Without stress. You just defecate so easily without stress. Okay? So right now, I hope now you know that age can affect what? Age can affect bowel elimination. Age, the diet, the fluid intake, the physical activities, your surgery, your medication, your position, your psychological factors, everything can affect you from what's defecating very well. All right, thank you so much. I'll be dropping this video right now, and see you next time on my video. If you want to hear more, or you need, or you have some questions that you want to ask, very free, you're very free. Go to my page, you'll see my number there. Contact me on my WhatsApp and I will talk about it. Thank you so much. God bless you. Bye bye.